My name is Steve Major. I'm a family doctor, um, part-time emergency doctor, and part-time yogi. I refer to myself as MD Yogi. I wanted to talk to you about the coronavirus and just give you some basics about the virus itself, and then just talk to you about some responsibility we all have to make sure we deal with this virus appropriately. So the coronavirus that we're dealing with currently is called COVID-19. COVID-19 stands for coronavirus disease 19 for 2019. There are four common coronaviruses that actually circulate year-round around the world and cause 20% of common colds. So if you've ever had a common cold, you've actually had a coronavirus infection. What we have with COVID-19 is a variation or a mutant of a regular cold virus that was basically mutated through exposure to another virus and became what we call virulent. Virulent in medical terms means much more dangerous, much more harmful. And so we've got a virus that basically normally causes the common cold, and suddenly instead of causing a common cold, it causes viral pneumonia, and that viral pneumonia causes significant inflammation in the lungs, and that significant inflammation in the lungs leads to difficulty breathing, and then depending on your medical conditions, requirement for ventilation and support. So it's important to understand this current one is a variation of the SARS virus. I worked in emergency in 2003 in Newfoundland when SARS came out in Toronto, and we had all sorts of fear that SARS was going to spread across the country. And I live in St. John's in Newfoundland in Canada, on the eastern part of Canada. And we dealt with SARS at that time. We were able to contain it, and thankfully it did a limited amount of harm, but it certainly did cause a lot of difficulty at that time. At that time, a lot of healthcare workers were the main people who got sick with that virus, and we learned things from that experience. So fast forward to 2010, we had the H1N1 virus, and that one was quite significant as well. Thankfully, associated with that one, because it's an influenza virus, that pandemic wasn't as bad because we were able to get a vaccine out fairly quickly. So in terms of the coronavirus, we know this mutated virus is very transmittable. When I started watching the news about this originally in December 2019, initially the information we were getting was that it wasn't very communicable. It wasn't very transferable between humans. Initially, it was sort of reported that it was actually transferable between animals and humans. And as time went on, the information changed. And again, today's date is March the 18th, 2020. And if you watch this video in a month, some of this information will be out of date, and that's normal with this information. As time went on with the coronavirus, this COVID-19 version, we learned that it was more infectious, and what we learned that it was transferable between humans, and subsequently we learned that it was more easily transmittable between humans, and finally now we know that it's not only communicable between humans, that it can stay on surfaces and then be transferred through surfaces, all of which creates a much more communicable illness. Communicable meaning able to transfer from one person to the next. And this current virus, the COVID-19, is actually more communicable than influenza, and influenza is fairly readily communicable. So we know that it's not hard for this virus to be transferred from one person to another. So I want to reflect, I've been in practice for 25 years, and when I graduated, it was at the height of the AIDS pandemic or epidemic, depending on how you look at it, and HIV was killing people. It was killing a lot of people at that time, and when I graduated, if I had to tell a patient that they had contracted HIV and that they had developed AIDS, I was telling them that they had a death sentence. Fast forward to now, in 25 years later, we know people who get HIV and they take medications, their viral load is lower, undetectable, and their immune system functions normally, and we've developed these drugs that are quite effective. So to my mind, something that was very deathly ill in terms of causing death, became treatable, and much more treatable, and very few people die now from an HIV infection or AIDS. And that's, because we developed medication. So I'm hopeful that in this case, with all the powers and the brains of all the different scientists in the world, that we're going to develop an antiviral medication that might be helpful. So we have some hope there. In the case of the influenza H1N1 pandemic at that time, which was quite severe, because we had already had influenza vaccination on a regular basis, we were able to develop a vaccine more quickly and readily, and that was able to stop that from spreading significantly and causing more harm than it did. Thankfully, again, a vaccine was quite helpful. So in this case, there's quite a bit of hope that a vaccine might be helpful for this. So what we're dealing with is a virus that initially we thought was not very communicable, and now we understand that it's much more transferable from human to human. So now we talk about, what do we do to control? We don't have a medication currently that works well. We don't have a vaccine that works well. And we know that if we shut down things and we limit contact between human beings, or what you want to call social isolation or social distancing, we know that we save lives. And I think that is what I want to do this video, is to express the real importance that all of us play in that social distancing. It's not just talk. It's not just somebody saying that, something that's not relevant to you. It's relevant to every one of us, and every one of us has the opportunity to be a superhero. And the best analogy I can give you is the superhero is Spiderman. And if you know the story of Spiderman well, I've read comics since I was a kid and know well, when he developed his powers, he didn't know what to do with his powers. And one night he was out, and somebody was robbing a grocery store or convenience store, and he just let the robber go. Now, unfortunately, that robber then killed his grandfather that he was living with. And Peter Parker had to live with the guilt then that his inaction led to the death of his grandfather who had brought him up. And so what I'd like to say to you is that your inaction in terms of your social interactions, or not limiting your social interactions, could cause the death of other human beings. That's pretty powerful. There's not many things I do in my job as a physician that I can say, I know definitely when I did this that I saved somebody's life. A cardiac arrest, an emergency, when we resuscitate an individual from a trauma, those types of things I know directly. This is something that you as a human being can make a difference. If you are feeling ill or you have symptoms of COVID-19 and you go out and transmit that virus to other people, you are doing harm to those people and potentially killing other human beings. I mean that. That's not hearsay. This is not a hoax. We have seen what this does to elderly populations. We have seen what it does to people who are in a nursing home. We've seen what has happened in Italy, where there have been so many people die that the system become sick, that the system cannot respond to it. The system is overwhelmed. There's not enough ventilators to keep people alive, and doctors have to make choices then on who gets a ventilator and who doesn't, who's going to die and who's going to live. We don't need to make those choices if you as an individual make a conscious decision to change your behavior, whether it's washing your hands, covering a cough, not going to work when you're sick, not exposing others if you're ill, not exposing others if you think you have COVID-19. And I appeal to you, this is an opportunity for humanity to show its best. This is an opportunity for us to show the world that we can pull together, that we can do what we need to do as human beings for each other with kindness and compassion. How do we take care of each other? How do we make sure that each one of us gets through this and is safe? And if we take the right measures, if we socially isolate when we need to, if we socially distance when we need to, we can all make a difference. We can all be superheroes. And I think that's the message I want you to take. I'm going to be working Emerge in the next couple of weeks. I know, even though I'm part-time, that there will be staff get sick, and I'm going to go in and do what I need to do. But you need to do your part as well. You need to do your part to make sure we don't have overwhelming numbers of people with acute illnesses that are preventable. We can see in other countries where people make these decisions to actually control their behavior and change their behavior, that they can save lives. If you want to be a lifesaver, if you want to make a difference, then you need to make decisions right now that will help others and prevent others from dying. And I appeal to you, one human to another, to make that difference. I know you can do it. I believe in you. I believe in humanity. And I thank you for taking the time to listen to my video and my plea. And as I always say at the end of my videos, you've got this. Keep safe. Thank you.